Good afternoon. I'm Steve Burns, Vice Chair of the Miller Center Governing Council. Our next panel, Climbing the Ladder, Social Mobility in the United States, will focus on fears about the future of the American dream. We have strived and often failed to provide equal opportunity to all of our citizens and to give each generation the chance to shape its own outcomes. Leaders from both political parties worry that the American dream has become more dream than reality for a wide swath of the nation. Moving the needle on social mobility will require bipartisan alliances and long-term strategy, as well as presidential leadership. Joining us to explore these issues are three experts and leaders. Kathleen Sebelius has made issues of social mobility central to her career from Kansas to Washington. As governor of Kansas from 2003 to 2009, she made a priority of education reform. And as the Secretary of Health and Human Services under President Obama, she saw the reform of health care as essential to providing Americans with greater opportunities. In the heartland and in the Capitol, she gained a reputation of working across the aisle and reaching compromise on the essential human services that allow all Americans to advance. John Bridgeland directed the Domestic Policy Council for President George W. Bush. In his nonprofit and consulting work, he addresses opportunity, health, and mobility, both in the U.S. and abroad. That includes work on issues as diverse as the silent epidemic of high school dropouts and the eradication of malaria. He continues to push for civic engagement as we confront today's gaps in education and social mobility. Chris Liu, the former Deputy Secretary of Labor under President Obama, refers to the DOL as the Department of Opportunity. Now that Teresa Sullivan, Senior Fellow at the Miller Center, his energies extend to issues as wide as the future of work, the role of community colleges, and financial literacy. The three panelists here today have worked to create practical, tangible solutions to boosting social mobility in America and to restore access to the American dream. Larry Terry, the Executive Director of UVA's Weldon Cooper Center for Public Service, will moderate the conversation. The Weldon Cooper Center leads in addressing state and local issues through research and through training civic leaders. Over to you, Larry.
Good afternoon, everyone. Again, my name is Larry Terry, and I'm the Executive Director of the Weldon Cooper Center for Public Service. I'm very excited to be here today for this panel, and what I know will be a fascinating discussion because the topic of social mobility is an important one that I think all of us recognize needs to be part of our daily discourse. I believe in many ways that the United States is most easily defined and recognized in part because of its core values. Life, liberty, and the pursuit of happiness are just some of the few that we typically identify with the United States, but we also can think about opportunity as a major value that we covet. I know this to be true, at least in my own personal story, because I'm actually married to an immigrant from Honduras who went on to serve in the United States Army after 9/11. And she embodies, and our family embodies, what opportunity means. And it's very important, I know, not only to me, but, and our story is not unique, but an important one to tell. So I hope that our discussion today will discuss a lot of what social mobility means, and how that's having an impact across the country. So let's get started with our very distinguished and esteemed panel with our first question, which is, when polled, Americans tend to overestimate the amount of social mobility that exists in their country. What is the state of social mobility in the United States? And I'll throw that out to anyone in the group who wants to tackle that first.
Well, maybe I can start. I think that we're in a situation where I'm glad Americans still feel optimistic about social mobility, but I think the facts are a little more grim. Americans born between 1940 and 1980 were very likely to double their parents' income and live at a better level than their parents had experienced. Those born 1980 to today, only about half of them are likely to be in a better situation. And I think we're seeing that unravel a bit. And I also think that if you look around, the Horatio Alger's story of rags to riches is unfortunately more likely to happen in Canada than the United States, about twice as likely to happen. We know that income inequality is inherited, and we know that a couple of things make a big difference. Education makes a big difference. Where you live makes a big difference, and affects a lot of other issues. So hopefully as we look at opportunity in this country, we can be realistic about where we are and realistic about what government can do to help change that trajectory.
I would just add, I spent 3 glorious years as a UVA law student and wanted to be a permanent law student after that experience here in Charlottesville. But it wasn't a certainty. My father grew up in shoeless poverty in a little town called Belleville, Ohio, and to a single mom. And because of the relentlessness of that mother who put him in decent schools and gave him educational opportunity, and because of the GI Bill, it's a real engine of mobility for the World War II generation. He had a decent life, we had a decent life. In addition to that, incredible data that shows that 92% of 30-year-olds in 1970 did earn more than their parents. And then by 2014, 51%, as Kathleen mentioned, were earning as much as their parents at 30. We were a little frustrated that data is 30 and 40 years old. So we actually worked with a group to create an opportunity index of 16 leading indicators that looked at education, the economy, health, and community, including a lot of the things that Kathleen and Chris have struggled with in government, and improved significantly, and discovered that there are actually shoots of hope in many states in the 2,600 counties across the United States that have these opportunity indicators. And it's not designed to stigmatize or criticize certain states or counties that aren't doing well, but to focus governors and mayors and leaders on what actually matters in boosting socioeconomic mobility. Third thing I'd say is, we're here in Charlottesville, and you mentioned Jefferson's mystical notion of the pursuit of happiness, and the Declaration is fundamental to America's creed. And in addition to that being an individual right of, being able to send your kid to college or have a decent home, a decent life, he and Adams were talking about that being a collective enterprise, the public happiness, and that I can't be happy unless my neighbor is happy, or I worry about the person who's homeless or vulnerable is happy. And so I think that spirit of Jefferson here at this wonderful place on this wonderful campus is something we should remember. Final thing, I talked to Joel Berenson, who was President Obama's pollster just last week, and he said the emblems of the American dream, which are get a home, buy a car, send your children to college, are now emblems of crushing debt. And that most Americans are retrenching, trying to simplify their lives, and really look to not as aggressive about pursuing the American dream and more retrenching a bit to simplify their lives so that they're not hit with the American nightmare.
Right.
Let me pick up on John's last point, because I think that's an important one. You all may have seen over the weekend the wonderful commencement address at Morehouse College, where the benefactor stood up there and announced that he was paying off the student loan debt for the graduating class. It would be fascinating to do a longitudinal study of those several hundred young men about what it means when you can start off in the work world without any debt, what choices you make, what difference you're allowed to make. But it does raise sort of broader questions. And again, while we can and we should celebrate the generosity of this donor, it begs a larger question. Why is that a private donor who's taking care of the student loan debt? Why isn't that government who's taking care of it? And if people say, well, look, maybe that's too expensive for government to do, it begs the question, why aren't billionaires like this gentleman being taxed at a higher level to pay for those government services. But cheap applause lines. But I think going back to Larry's original question, when I think about optimism, social mobility, I also think about it sort of depends on where you're sitting. You think about Amazon making the decision about where to place their second headquarters. There are 20 finalists for places like Philadelphia, Washington, Atlanta, Boston, urban or suburban areas that are already doing very well, that were catered towards a well-educated workforce that had good infrastructure around them, places that people wanted to live. And I think the challenge we have in this next century is, what about the places that have been left behind? And that's not a red state versus blue state issue. We see that right here in the Commonwealth of Virginia. Northern Virginia is booming, Richmond is booming, Southwest Virginia isn't booming.
Right.
How do you get jobs to those places, or do the people eventually just kind of leave and go to other places? And so if you're sitting in one of these cities that's one of the 20 finalists, you're probably wildly optimistic. If you're sitting in a place that companies don't want to go, you don't really see much of a future ahead of yourself.
Well, I want to pick up on that a little bit, because I think the geography that Chris just talked about, where we're seeing a wider and wider geographic divide. And there's a lot of evidence and studies looking at the South and the rural Midwest that is really falling further and further behind. And whether you look at healthcare or education or jobs, it's an indicator of all sorts of situations that don't bode well for the future. I did some looking at just housing patterns and housing issues, because the GI Bill, which John mentioned, was probably the biggest jumpstart for the middle class of our parents' generation, where you had education and a VA loan that you could buy a house with no down payment and very low rates, if you were white. If you were a white soldier returning. African American soldiers had access to education. They did not have access to mortgages. Now, think about that as a generational issue. So the mortgages that our fathers got coming back from the war, a house is someone's largest wealth in the family. You could borrow against your house to send your kids to college. You could borrow against your house to pay for your daughter's wedding, to move to a different house. If you didn't have that house, if that wasn't part of the deal, and again, we had a housing pattern, and this was the federal government doing this very segregated pattern where African Americans got subsidized housing in housing projects and were driven into urban areas. White returning soldiers were subsidized into suburban areas, and houses were built. The boom started. The vestiges of that, I think we're still living with today. There was a governmental decision to begin to divide wealth. I come from, Topeka, Kansas. Brown versus Board of Education will be 65 years old this month. That fundamental decision. Well, we're living in an era now where people are desperate to get out of their neighborhood schools, not to attend their neighborhood schools. So geography matters. What Raj Chetty has found in his Harvard studies looking at inequality is that if you move at a very early age, if you move to a different place, if you have a housing voucher to get into a different neighborhood, it can make a lifetime of difference. You go to a different school, you have a different trajectory, you have a different way of living. So I think, again, as we look at what the possibilities are in the future to begin not only retiring debt that people have, but maybe giving upward mobility to areas and neighborhoods and individuals who don't have it, we got to look at some of the structural issues. Health is certainly one of them, but education and where you live, what your zip code is, what your geography is, can have an enormous difference.
Yeah, just building on this geographical point. I don't want to.
We're not gonna let you
Or
have
Larry, what's it?
Go ahead.
But that both Chris and Kathleen touched upon, it's interesting. Americans remain extremely entrepreneurial. When you talk to them and poll them, 61% have a dream vision for a business they want to start. And more than half would do so if they had the tools and the support. And then we've discovered that, unfortunately, venture capital in the country, 80% of it flows to just 4 states. And so in the heartland of America, in these places where it's so desperately needed, and interestingly, virtually all net new jobs that are created in the United States are created by new enterprises. It's not the size of a business, it's actually the age of a business. And so we've had a startup downward trend for the last 40 years, remarkably, even though the economy is showing some signs of recovery. And I think to Kathleen and Chris' point, we really need to bring more venture capital. There's this guy, Steve Case, who started AOL, who started a campaign just on his own as an entrepreneur called Rise of the Rest. And he's going through West Virginia and Kentucky and Appalachia and other areas of the country, and basically raising money for great ideas that the marketplace should be investing in to create new jobs and to help these entrepreneurs that want to make it.
I will add one thing. One of the most moving trips I took when I was the Deputy Secretary of Labor is I went to Flint, Michigan in the middle of the water crisis. Flint was, again, 30, 40 years ago, a booming town. It has shrunk significantly as the auto industry has shrunk. Unemployment rate is well into the double digits. And I remember talking to people, and I said, look, you can't find a job. There's one grocery store in Flint. You can't drink the water. You can't bathe your children in the water. Why do you stay? And they say it's home. And it's the irony, because if you think about throughout at least the last century, people moved to where the jobs were. That certainly happened during the Depression. That certainly happened after the war. At a period of time when there's more actual mobility of people, there's probably the ability for people to move. People are moving less and less, and there's a variety of reasons. They can't compete for the jobs in these new places. Many people are underwater with mortgages and can't get out of that. Family ties as well. So if people aren't willing or aren't able to move to where the jobs are, how do we bring the jobs to those people? And I think that dovetails in what this initiative that Steve Case is working on right now.
Well, and the movers are more likely to be educated
Right.
and have some assets, and the mobility goes with that. So it's sort of this divide that in some ways is being amplified, not reducing.
Yeah, can we talk a little bit more about sort of this relationship or the link between education and social mobility? Because I think we can all agree that there's a difference between having a job, but also having a job and being able to be upwardly mobile, right? And so what is this connection between education and social mobility that we might be overlooking in terms of our thoughts on economic development or economic prosperity?
So it's interesting. Oh, I'm sorry, Kathleen.
No.
A college graduate will make, on average, $1 million more over his or her lifetime than a high school dropout. And interestingly, in 2003, Gates Foundation called and said there's this high school dropout problem. Nobody knows anything about it. And 1.2 million people are dropping out every year. And I was in Philadelphia. It reminded me a little bit of your Flint story. And we were doing a focus group. First time in the country since 1870 talked to young people who had dropped out from high school. And there was this girl in the focus group, Monique, and we asked her, what did you want to be when you were growing up? She said, I wanted to be an astrophysicist. We said, what? She said, wait, was inspired by the NASA space program. She kind of took over the whole focus group. 30 minutes later, she was asked, what are you doing now? And she was a prostitute on the streets of Philadelphia. And the marketplace of the streets was more engaging and producing income for her than what she saw in her school. And the nation actually focused its attention once the dropouts spoke and said, most of them can make it, we have same dreams as other kids, but we need pathways that connect opportunity and career and what we want to be in life in school. And the good news is graduation rates have gone from 71% in 2001 to over 84%, and across 2 administrations. I know you don't hear a lot of, political unity in the country much, but across the Bush and Obama administrations, both administrations focused like a laser on it, and 3 million more kids have graduated from high school rather than dropping out over that period. The bad news is there remain more than 2,000 what are called high school dropout factories in the United States. So the average graduation rate, just hear the statistics, remarkable, for most students in most high schools in the United States is 90% or higher. And in the remaining 2,000 low-performing high schools in these places that we're talking about, in parts of the country that have no viable economy, lack of affordable housing, lack of health inputs, the average graduation rate is 40%. So imagine going to a high school where most of your classmates are going to be dropping out, and the climate and the culture and the lack of expectation that creates. So the country's starting to focus again on, how do we reform, redesign, and these remaining low-performing high schools, because it has a huge effect on mobility.
But I also get very frustrated having worked on this for a long time. I started in the Kansas legislature when my kids were 2 and 5. And so early childhood education, early childhood initiatives were pretty personal to me and I thought pretty important. That was a long time ago. And we are still talking about data that we know the single best investment, with all the glory that is here at the University of Virginia. I would suggest that the most important education that anybody is going to have is by the age of 3, because that's when the brain is developed, and that's when we should be focused. And again, we have lots and lots of information that says kids who are in high quality early education program have a lifetime that is very different than their peers or friends, even if they live in abject poverty, even if their parents didn't finish school, even, you have all the factors. They're less likely to be involved in drugs. They're less likely to be incarcerated. Just those early years. And we cannot get our hands around, as a government, the notion that we should have paid parental leave, we should have guaranteed early childhood education. I mean, think about the Morehouse situation. If it had been said to a group of high school kids, you could be in the class of 2019. If you finish high school and you go to Morehouse College, you will not have any debt in the world. How many kids would have taken up that? I mean, the earlier we present that possibility, it's wonderful, and I'm not diminishing having graduates, but those are the kids who made it through all the way. I don't know how many along the way dropped out or never went in the first place because they didn't have the resources. And what we know is a college education is one leveling factor. If you get a college education, it actually puts you on par with peers and others, regardless of your background and your family history. So starting that early it's insane that we don't do it in this country. It just makes no sense.
When people used to ask me what the best way to train a worker is, I would say universal pre-K. It needs to really start that early. I do think, one of the things that we need to change our mindset in this country, we used to say everyone should go to college, kind of the way we used to say everyone should own a house before the recession. We don't say that anymore. And what we need to understand is that the economy has fundamentally changed. In the post-war era, post-World War II era, you could graduate with a high school diploma, you could get a good paying union job that had health care and retirement benefits. Those jobs don't exist anymore. And what we have not figured out in this country is for people who either don't want to or are not equipped to go to college, what is the alternative path for you? Mm-hmm. And what you've started to see now is, we moved away from vocational education, vocational high school about 20 years ago. We're now re-embracing that again. Community colleges are now coming back. There's been this powerful bipartisan movement to embrace apprenticeships, which is a model that is used in Switzerland and Germany. It's amazing. If you go to Germany, they let kids at 16 years old make a decision about what their first job is going to be. We don't let 16-year-olds decide what movie to go to in this country. And so, so it's not only providing that extra level of education and training to get your first job, but it's how do you create a culture of lifelong learning? Because as the economy moves as fast as it moves, you're increasingly going to have 40 and 50-year-old people who are now moved out of their jobs because of technology. How do you retrain them for the jobs of the 21st century? That's not something we've done a good enough job on so far.
Yeah, I saw a statistic the other day, 95% of the jobs coming out of the economic recovery required some level of post-secondary education.
Yeah.
Remarkable. And Chris is right, I think we need, the one-year occupational certificates, the community colleges in this country, and there are places like Miami-Dade and others who are doing remarkable things with populations that, previously had no chance, really, at making it into the economy. And this other point about universal preschool education, there's bipartisan consensus on it. I don't know why it doesn't happen. And interestingly, the studies show that we actually have a social gate to learning, and you can't just put a child in front of technology or a screen. You actually need a human being. Because I think one positive development is not just a focus on academics, but like the social and emotional development of young people early on is really critical.
Well, there were some great efforts. I don't know exactly what was going on in the Bush administration. I do know that education. But there was a lot of collaborative work between the Department of Education and Health and Human Services in the Obama administration, because in Health and Human Services is Head Start, early Head Start, a lot of the block grants about child care. The Department of Ed ran the schools, and we, for the first time, began to pool resources and give people at the local level more kind of joint grants. And the notion was to take Head Start knowledge, which often involved parents, a lot of social and emotional learning, and combine them with the curriculum appropriateness of a school and have it run in a way that you could do it in a schoolhouse, you could do it in a center, you could put it in a church basement, but both elements, recognizing that if a 3-year-old or 4-year-old can read and they can't sit in a chair, that doesn't do them much good. If they can sit in a chair but they can't recite their colors and they don't have any idea of numbers, that doesn't do any good. But it is tracking that mobility and knowing that involving parents in that educational process and opening up the schools so that parents who may not have finished high school or may want post-training can also attend and not only become better parents, but become better workers, has been, again, experiments. Cincinnati does a great job. John and I discovered we're both from Cincinnati. They have a big communities and schools program where they wrap services around not just the children, but the entire neighborhood. And it becomes a place of learning, so people's educational opportunities are really reopened. Those kinds of things, I think Chris would acknowledge that the Department of Labor, looking at them, I mean, they really work, and you can help lift a whole family at a time and not just try and isolate 1 or 2 people.
And the supports become increasingly important when we're talking about low-income parents, parents that don't have a lot of education. Study after study shows the reading levels of kids from low-income families during the summer goes down because reading is not innate in the culture of parents reading to kids at that age. Parents don't have time. Or if you think about schools, being a provider of school lunches and increasingly school breakfast for low-income kids, when those aren't provided during the summertime, what it does to the kids' health, their well-being, their ability to learn. And so you need to not only focus on what happens during those 9 months, but what happens during that summer period as well.
Chris, you mentioned earlier that the economy is changing. I was in Southwest Virginia last week for a significant portion of the time at an economic forum that looked at technology as sort of the catalyst to potentially bring about change. Are we connecting our educational opportunities with the needs of this changing economy? I think that that's something that can be perceived as a disconnect between our educational institutions and the reality of what's happening out there in this new, often information-driven economy.
I mean, I think the answer sort of depends on where you are. If your kids go to school and there's no broadband there, there's no ability to access computers, laptops, they're going to struggle. And your ability to use computers now is essential to your job. Or if you think about, I would say when I would go into a vocational high school, or I'd go to a community college and I'd go and tour their training facilities, when it looks like my high school shop class from the 1970s, 1980s, that's probably not training people for the jobs of the 21st century. When it looks like a machine that you would see at a high-tech factory, that is when you know that there's that nexus between business and employment, business and education, but it really takes a whole of government approach. You not only need the workforce system involved, the education system, you need business involvement for this to work. We used to always laugh. I mean, the training system in our country has for too long been train and pray. We train people for jobs and pray that they get them. That just can't be the way it should work at this point.
And often, I think, at least we found this at the state level, which sometimes can be more nimble and entrepreneurial in terms of jobs, that we had a jobs council of major employers who would then, mostly with partnerships at the community colleges, they found it very beneficial because they frankly had to do a lot of the job training on their own. If you wanted to work in a Boeing plant in Wichita, you had to go through a year of their training regardless of your educational background. Or if you wanted to do, be in a culinary institute, you had to do a different kind of training. The employers would design, say this is the actually core of the curriculum we need to be taught. The community college would provide the educational opportunity, and the partnership was amazing because it was not training people for jobs that didn't exist anymore. It was employers saying, we need welders, painters, we need machine shop workers, we need skilled mechanics, we need this. We'll give you the curriculum, you train them, and it was sort of a win-win situation. And the more that can occur, and particularly with targeted populations saying, if you finish school, there is a pathway to a job, and not just a job, there's a pathway to having a way to sustain a life, to support your family. You may want to have a side hustle, but we're talking about a living wage job. That's the other thing about, I think, employment numbers that I'm always skeptical about. I want to know what these jobs are. If you've had a job, as Chris said earlier, that had pension and benefits and had a pathway to moving up, and now you are flipping burgers or driving Uber or doing any number of things that is part-time, part-based, no support, no trajectory. I think we have a false sense of what employment is like right now in this country.
Yeah, just building on, the employment numbers don't include the millions of Americans who've stopped looking for work. I see in my own neighborhood in Northern Virginia, all these 40 and 50-year-old men and women who are out of work and not looking for work and struggling to make ends meet. And the other thing is, essentially, businesses have been so frustrated for a long time with the lack of training and preparation of the workforce, and IBM created a program called PTech, which actually reaches down into 9th grade and provides the curriculum and educates and helps train high school students from it's called 9 through 14. And so when you finish, you not only get a high school diploma, you get a 2-year associate's degree, and you're first in line for a job at IBM. And it's sort of taken off in 200 communities across the United States. And I think having business innovate in that way as early in the system as possible is really helpful.
And it's important as business also understanding you don't really need a college education for many of these jobs. One of the great models is how this apprenticeships, which we often think about as the trades and construction, are now moving increasingly into white-collar jobs. Great example is Zurich Insurance Company, obviously big Switzerland, Swiss-based insurance company, has now created an apprenticeship program for claims adjusters. Because what they've realized is, look, we can hire 4-year graduates, we still have to train them. And frankly, most of them won't stay in these jobs. So why don't we, as Kathleen said, why don't we form a partnership with a local community college? They spend half their day here learning how to do the job. They spend half their day going to college. We pay for their college. So there's an understanding that they stay and work here for several years after they finish. And what they have found is that they get a more engaged workforce that is more likely to stay. And as importantly, they're going to get a more diverse workforce than they would have otherwise gotten as well.
Going back to the kind of basic social mobility, and I feel like I'm the grim reaper here, but I keep looking at the historical, institutional barriers that are, and there's no question government can do a lot of positive things and can change this trajectory, and government has also done, I think, a lot to impose status and unequal status on a number of people. I mentioned our earlier decisions in the housing market that really did change generational wealth. I think you don't need, in terms of social mobility, to look a lot further than what we have done with our correctional system. And we have now generations of individuals, heavily black and brown, heavily male, who will be sort of condemned, not only themselves to a flat dead-end job, but their children are likely to have a much more difficult time. I mean, we have, I'm pleased that with the newest opioid crisis, we're again saying, maybe this is a public health crisis, not a criminal justice crisis, but there are millions of people locked behind bars because they're addicts and because they were caught up in an earlier system where we thought lock them up was the way to go. So I'm concerned that as we address the future, we also try and level a bit the playing field for what's going on, making it easier. I was really pleased to see Florida pass the bill about allowing people as they're coming out of prison to vote. But voting is one thing. Getting rid of some of the questions, and we, Chris will remember, we had a lot of discussions in the Obama White House about filling out a job application. How much information should you require and take about prior criminal history? Because in many places, it's the end of the conversation. Even if you've paid your time, even if you are supposedly rehabilitated, you don't get a second chance.
Right.
So some of those policy issues that are still in place, I think need to be, if we're serious about social mobility and changing the trajectory, we kind of need to look at what government has imposed and keeps in place that could be changed, could keep us still safe and secure, and could give people an opportunity to move in a very different way.
I'm glad you raised that because I think it's another area of bipartisan consensus and more needs to be done. We discovered there were 2 million children of incarcerated parents. So think about being a child growing up in America and having your, one or more of your parents and both parents in prison. We provided mentors to those children, but again, helpful but insufficient. And I just saw the Justice Department, I think, was sued the state of Alabama for the miserable prison conditions. So the conditions in these places, as people linger and languish in prison. And there's so much we can do. The drug courts for nonviolent offenders, redeeming and expunging the prison record so that when people come out, they can actually get a job. Particularly for the non-violent drug offenses, and
that's a third of our prison beds.
It's a third, exactly. So it's something I think much more needs to be done.
Yeah.
I want to pivot for a second to healthcare access, and social mobility. It was mentioned, I think, at the beginning of the panel about where you live matters. It often tells about your access to education, jobs. There's also a lot of data out there that often where you live, or whether it's rural or urban, can have an impact on access to healthy living and healthcare. So what is the connection that you see with healthcare, being healthy, and social mobility? And Madam Secretary, I'll start with you, of course.
Well, I think there's a lot of information about the so-called social determinants of health. And that's basically everything that goes on that affects your health that doesn't occur in a doctor's office or in a hospital. And mostly people are healthier or less healthy because of those social determinants, not necessarily the health care they get when they're sick. So it's the air you breathe, the water you drink in Flint, Michigan, where you live, what kind of food you have access to, do you have exercise, all of those environmental, economic issues have a huge impact on lifestyle, lifespan, how you conduct yourselves. And unfortunately, if you're less likely to have benefits related to your job, you're also spending more out of pocket or not getting the preventive care. So there's again, a spiraling situation. We can do a lot to impact the social determinants. One of the things that's, a lot of people saw the Affordable Care Act as really dealing with health insurance. And I would say that was certainly a piece of the puzzle, but a much broader piece was this notion that every agency should take some responsibility for health. And that if governments began to look broadly at a health in all places, so what that means is the Department of Transportation put a lot more efforts behind rails to trails and making sure that if you're going to build a highway, you also have some public transit, you have places that people could walk. The public housing HUD, for the first time, had smoke-free public housing.
Right.
The notion that people who had subsidized housing had to be in a smoke-filled environment was pretty insane. Looking at the kinds of, frankly, crap we fed our kids every day in school cafeterias, subsidized with government money. I don't know about the rest of you, but ketchup is not a vegetable. It is not a vegetable. And but over and over again, the policies that were essentially part of our structure were making people a lot less healthy and not encouraging health. So there was a sense that we all needed to, health wasn't just about the health department, it was really about life. Being healthy is not just an absence of disease, it's being able to live to your full potential, it's living longer, and I think that has a lot to do with social mobility. Again, it's part geography, it is part what access do you have to recreation, clean water, clean air, where you work, the kinds of jobs that you have, are they safe and secure? That can have a huge impact on health.
Absolutely. Chris, did you want to chime in on this?
Well, and we've seen this played out very dramatically with the opioid crisis. We think about that in terms of lost lives, but think about that in terms of a depleted workforce. And you hear that over and over again in rural communities that are struggling with opioids. Employers can't find enough healthy people who can show up at work. And at the Department of Labor, we used to have this, there's a running debate about whether drug testing is appropriate or not, and we can obviously say that for certain types of occupations, if you're operating heavy machinery, we should be drug testing. But understand that in certain communities, the more you move towards that, the more and more you're filtering people out, potentially out of the workforce, and people who desperately need jobs. And so there is a very close nexus, as Kathleen said. It also raises broader questions in this country as we talk about healthcare, again, about the connection between jobs and health insurance, which was a tight connection that we've had in this country when employers offered health insurance, where people stayed with their employers for most of their lifetime. As we move more and more towards this gig economy where people are cobbling together 3 or 4 side hustles, they're getting insurance from no one. What that does in terms of their ability, not only in the short term, but longer term implications down the road. And again, it sort of speaks more broadly that while Kathleen and President Obama did remarkable work with the Affordable Care Act, we still have to go much further in expanding health care.
Please.
All I wanted to just mention is the data shows that not only were bankruptcies the number one cause, the number one cause of bankruptcies were medical bills. And half the people who ended up bankrupt with medical bills had insurance. This is not a lack of insurance, it's they can't pay their bills. Right now, about 60% of the people with health insurance cannot pay their medical bills, are terrified that something is gonna happen, are worried about. So I think we still are a long way from people feeling economically secure with health needs looming, and you know, what they have isn't satisfactory.
Yeah, I would just add that with the changing nature of work, and you know, people aren't going to go to that company and stay there for 40 years so much anymore. There's the gig economy. Americans love the flexibility of doing their multiple gigs, but most of them are working without a safety net. And so I think we have to figure out how do we make benefits portable from job to job to job, including healthcare, retirement, and unemployment. You know, I had this experience that I chaired something called the White House Task Force on Disadvantaged Youth. And the first thing we asked was, how many federal programs are actually working to help the 15 million young people at risk of not reaching productive adulthood and their families? And the answer came back 339 federal programs spending $225 billion a year. And Peter Orszag and I wrote this piece for The Atlantic called, "Can Government Play Moneyball?" Is there, you know, what's the evidence that these programs are actually effective? And interestingly, in Kathleen's world, in Health and Human Services, we found a really wide array of programs, very simple, very powerful. One example was called the Nurse-Family Partnership, or Home Health Visitation. We just put a nurse in the home of a low-income mother who they get the immunization schedule, healthy food to eat, keeping that young person on track from the womb onward, and it not only boosted the life prospects of the baby, the child, educational, health-wise, but the employment prospects of the mother and the health of the mother. The entire family benefited. So there are these gems in government that we can build on. And I just want to say publicly, the Affordable Care Act, we're seeing in all 50 states and many of these 2,600 counties that health insurance coverage is one of the leading indicators of boosting social mobility where there are these hope spots. And it was a real feat that you did that. The Vice President's comments were merited.
I think we're getting...
To that end, just, I do think the reason that Medicare for all, that phrase, and I have to tell you, I'm not sure anybody really knows what that means, but because it means lots of things to lots of people. It is the one health program that we have done in this country where everybody's in.
That's right.
So it is not divided by economics. Medicaid, the children's health insurance, other areas, it depends on income. And subsidies for the Affordable Care Act depend on income. And there's a sense of fairness and unfairness that continues to roil. Medicare, you turn 65 and you are in. And in some ways, I think that sense of it's a program for everybody has made it invincible to attacks, and everybody feels it's a program for them. And as we look about healthcare in the future, I think that element is a really important piece of it. It isn't where you work, what your job is. It shouldn't be where you live, which right now determines, I mean, I have to tell you, given our geographic divide in this country, if you are in a state and you are low income in that state that has not expanded Medicaid, you are below the poverty level in Kansas, and you are too poor to qualify for anything, you are really in a world of hurt because there is no option for you to have any access to health care as you move forward. And that's a terrifying place for people and their families to be.
I think we're close to the Q&A session from the audience. I just wanted to ask each of you one question here quickly, maybe a minute or less. Is there a role for service at the community, local, national level for increasing our opportunities for social mobility? Given each of you have had very prominent public service careers, I think it's an appropriate question to ask each of you.
Yeah, I'll jump in. It's interesting, General McChrystal came back from commanding troops in Iraq and Afghanistan and said for the first time in history, less than 1% of Americans were serving in our nation's military during war, leading to the complacent assumption serving the country was somebody else's job. And he actually out at Aspen Ideas Fest, much like President PrezFest. He calls for large-scale civilian national service that 18 to 28-year-olds, as they come into adulthood, would come together and do at least a year of civilian national service. And the power of it is, think about, we have the low, Robert Putnam, Bowling Alone, our kids, we have the lowest levels of social and institutional trust in history. The fraying of American communities, political polarization, we saw it here in Charlottesville in spades. The power of bringing the next generation together across race, ethnicity, politics, faith, income level, in common purpose. When Jay Rockefeller went into Vista, he went into the poorest community in West Virginia and spent the rest of his life as a U.S. Senator from West Virginia representing the interests of the impoverished. I mean, it changes your life. And so I think it's interesting, a lot of the presidential candidates are, calling about national service. I think the big idea would be, if you invest in your country, we'll invest in you. For every year of civilian national service you do, you get a full year of tuition, public tuition in your state paid for. And imagine you do 4 years, you got 4 years of college and a BA. You got 2 years, you have a community college degree. And that kind of reciprocity, it worked with the GI Bill, to your point about make sure it's equally provided across races, ethnicities, and income levels. And that there's a requirement like the military that you reach people from all backgrounds, I think is a big, powerful idea whose time has come.
I'm a huge proponent. I mean, I think mandatory service. And military or civilian, and you choose. But I think it is a recipe for a lot of education and opportunity, and it changes people's view. I was just in Columbus, Ohio, at visiting family, and my young nephew is in I guess my nephew's son is in a child care program near the state capitol. One of the things that they are doing, which I've never seen before, but I thought was fabulous, is there is a relatively low-income high school that is close by, and they are getting, particularly the boys in this high school, to come and spend some hours working in the child care center. And I met one of these young men who was 17 years old, and he said, "This has changed my life." And I said, "Well, what do you mean it's changed your life?" He said, "When one of these little guys comes up and gives me a hug and says, 'I love you,' he said, I'm trying to figure out how to go to school and learn about elementary education. I never thought about trying to be a teacher. I want to be a teacher." He said, "This is the most powerful thing I've ever done. I've done a lot of different summer jobs. I've never done anything like that, and I'm really having an impact on these kids." It was a total game changer for him, and it's great for the school, it's great for the kids in the school, but for this kid, it was like opened a door into a world he never knew existed. And I thought, how many times could that be replicated over and over again? I think it would be terrific.
And I'll echo what John and Kathleen said, and simply said, it's not only about engaging people into the community, giving them a greater understanding and empathy, it's also powerful as a way to develop job skills among disadvantaged youth. Just the simple act of getting up, getting dressed, going to work, knowing how to conduct yourself. It doesn't matter if you're working in fast food or you're doing community service. It's those same quote-unquote soft skills that you develop. That model has also been used for senior citizens to get them out of the house, give them something productive to do. And so there are powerful examples of how this can be used, community service can be used as a job training tool.
Excellent. Now we're Q&A. Yes, okay, here we go.
Hi. So for our first question, how much is economic inequality driven by increasing automation, and what can policymakers do to protect jobs threatened by automation?
Next question.
I think there's, and these are the job experts here, particularly Chris. It does strike me that automation is certainly a likely job replacer in all kinds of jobs. But that just, I think then requires us to look further into the future and say if these jobs are going to be automated. So green energy jobs, for instance, it's pretty tough to automate. Putting a green roof on a house or insulating for a low-income family or two. So there are ways to look at the economic future and train people for jobs that can't be automated, can't be moved out. The kind of service jobs we're talking about, you can't automate and move aside. Will skilled manufacturing take over where there were 15 workers in the past? I got to tell you, in the farm community, you know, one good combine with a GPS is replacing 15 farm workers because you just don't, you know, you don't need the kind of manual labor that you had in the past, but there are other things that those folks can be doing, and that's what we have to help people how to pivot from what they were doing to what that looks like in the future.
I'll simply add that there is a level of jobs that is disappearing and changing because of automation, and like Kathleen, helping people adapt with education and job training is essential. I think what we also need to understand is there's a whole level of jobs that will have to be done by people in this country, and for those jobs that have to be done by people, we really have to pay them actually a living wage. I'm thinking specifically about, you know, certified nurse aides, which is the lowest rung of nursing and hospital. I'm thinking about childcare. I'm thinking about elder care, which will become increasingly important, and understand people, those are some of the most critical jobs, and we ought to be paying people more than minimum wage to do those jobs.
We actually, yeah.
You bet.
We actually did an analysis over the last 2 years of what it would take to actually have a mandatory national service system in the United States, and the biggest need was elder care. And no substitute for the human touch, and so envisioning mobilizing mass numbers of people who in nursing homes or assisted living facilities or other areas, hospitals, could be working with the elderly, or Meals on Wheels programs. And so at some level, automation, it's hard to replace the human touch that's so vital.
Well, 10,000 people a day turn 65 right now, every day. And your nurse at home program works really well also to keep people aging in place. Well before you would have to abandon a home to go to a nursing home, if you have people coming in and out, people are, first of all, they want to stay as much as possible, remain independent, but it does take a human touch often to provide some of those wraparound skills, but we're going to need a lot more of that.
We may have time for one more.
How can colleges reconcile their interest in promoting diversity and social mobility with their self-interest in admitting the children of big donor families? And how will the recent scandal affect admissions policies going forwards?
Yeah, the clock. I think we have 2 minutes to answer. That's a doozy to throw at us last.
Yeah, oh God. Thank you.
Well, I mean, I think it's naive for anybody well acquainted with private colleges to suggest that giving money to a university wasn't advantageous perhaps to your family. This is a whole different level. I don't know about imaginary crew teams in the past or sailing. I'm not quite sure how a kid doesn't know that they're being photographed to be part of a sailing team. Anyway. But I do think, you know, there have always been legacy programs. There have always been, you know, buildings named for donors, and the donors are there. I don't see that stopping anytime soon at private universities, but I think then you have to bend over backwards extra hard to look at what are the policies that actually then can create pathways for people who, you know, don't have the legacy entry, don't have a way to get to school. And I don't know about the rest of you here, but when our 2 kids, I mean, both my husband and I, you know, are well-educated, have graduate degrees, helping children just apply to schools is daunting. And I can't imagine what that process is like if you have not ever gone to college, and nobody in your family has gone to college, and you don't know how to do that. We got to spend some more. If we really want kids to be college ready, if we really want kids to have that pathway, we have to start when they're freshmen in high school and give them somebody and say, when you're ready, I'm going to do everything I can to help you. And not to just fill out the application, to know when the timetable is, how to write an essay. I mean, all of those fundamental things that are tough enough, but I don't know how kids get to college if they don't. I mean,
I'd say, thinking of Jim Ryan and, wait, what? that this just happened in our country, but I think it did wake up the country to the fact there is a lot of bad dealing and things that clearly cross the line. But to your point, it's so interesting that the counselors in the United States, the ratios on average are 492 students to one counselor. And it's worse in the low-performing schools. And the last time the country actually invested in school counselors was the 1958 National Defense Education Act, where we were, sending Armstrong to the moon and creating a generation of engineers, and needed counselors in schools to actually keep people on track to get into college. And so I think making that more equal, and I know universities like the University of Virginia value the diversity of its student body almost over anything. And having that mix of experience and background coming together is a huge, as important, if not more important, than actually what you learn in the classroom.
I'll end where I began with talking about these young men from Morehouse College. It will be fascinating to see what these several hundred young men do now that they're freed from the debt of kind of a crushing student loans. But I hope we don't have to wait 40 years for us to figure this problem out, because we don't have that amount of time.
that's right.
And with that note, we are actually out of time.
Well, thank you.
Thank you to our panelists.
Let me thank our panelists and thank all of you for sticking with us in a long day. We start again tomorrow at 9:30.